lymphedema also developed in the head and neck. I have treated so many cases of head and neck lymphedema because that lymphedema not only affect the functions, they also affect the swallowing. That is the main function for our life. So swallowing is affected and the swallowing is improved a lot after this treatment. It's not only head and neck lymphedema. I have treated so many truncal lymphedema. So the one side of the trunk, upper trunk, lower trunk, the genital regions, they all are swollen. And with this treatment, I can get very good results. And then activity and the daily living activity of the patients, quality of the life of the patients will improve. Now we know the lymphedema by the numbers. It's very important to know the numbers because we are not that much aware about the lymphedema and the different cases of the lymphedema. The numbers are really very high. If we show in a breast cancer, 25% of the survivors, they may develop the lymphedema. These numbers are by the recent research. 70% of the men develop the lymphedema after the post-prostate surgery. 47% of the prevalence has been found in the patients surgically treated for the endometrial cancer. 50% of the patient after the head and neck surgery, they may get developed the head and neck lymphedema. So these all are the numbers showing the prevalence of the lymphedema cases. So the number of the cases are increasing. Why? Because of the survival rate is increased. Because of the advanced technique, now the survival rate is increased. And after the survival rate is increased, they may also increase this kind of complications. 75% of the lymphedema that developed within first 2 years of initial treatment. As I said, 25% of the survivors, they develop the lymphedema. In that, mostly the lymphedema developed within first 2 years of life, first 2 years of after the surgery. But it is not like that. They may not get the lymphedema in the later stage of the life. I have seen the different cases, they may develop lymphedema 5 years after the surgery, even after the 10 years after the surgery. So each and every patient after the surgery, they have the equal chances of developing in the lymphedema in the later stage of the life. So here our role is there. Our role is definitely there in the prevention of the development of the lymphedema. If the patient start the treatment after the surgery, as ma'am said, after the surgery on the second day, if we start our treatment, we explain each and every risk factor. We explain what is lymphedema, what are the risk factor, what to do, what not to do, and the self-management. So the chances of the development of the lymphedema is very rare, and it has been proved in the research. The self-MLD technique, all the precautions and all the treatment, if the patient start before lymphedema, before the development of the lymphedema, the chances of the development of the lymphedema, that is reduced. So as these numbers are showing that a clear need exists for improved understanding of the contributing risk factors, as well as we should develop the prevention and the management strategies to reduce the individual and the public health burden for these very disabled disorders. So definitely by showing this number, I can say we should work on the case of, we should work on the, not only for the management of the lymphedema, we should work on the prevention to reduce all these numbers. So what happened when the lymphedema is well established? This is afterwards. The lymphedema may cause the fatigue, which is related to the size and the weight of the extremity. But obvious, when the volume of the limb is increased, the all the patient's ability, severe impairment in the range of motion, patient will not use his or her hand. So that will reduce, that will develop the muscle wasting, reduces the muscle strength, and gradually that will develop the restriction in the daily activity. Embarrassment in public, it's of course that will create the different kind of the emotional issues. Gradually, they may develop the different other complications with the lymphedema. On the affected side, the fibrosis, soft tissue fibrosis. If the fibrosis is developed, then our treatment become more and more vigorous. It may develop gradually, it may develop the recurrent bacterial and fungal infections. These are very common after the development of the lymphedema. And researchers has proved that survivors, the cancer survivors with the diagnosis with the lymphedema, they may have a poor quality of life. So here again, we have to work to improve the quality of life. So patient will not suffer with all these issues. So before going to my management, I want to make you understand about the anatomy, because without anatomy, without understanding the pathway, you would not understand the exact mechanism and how it works and the treatment strategies. So what is lymphatic system? It is same like the circulatory system. As the circulatory system circulates the blood, the lymphatic system circulates the lymphatic fluid. But both the systems are interrelated. That is shown in this figure. Okay, but the difference is circulatory system is a closed pathway. You can see the heart, arteries, the capillaries, veins, and heart. So it is a closed pathway. But the lymphatic system, they collect the fluid from the interstitial tissue. They collect the fluid from the interstitial tissue and then transport all the lymphatic fluid to the venous system. So the lymphatic fluid that is drained into the venous system. Here in this figure also you can see the lymphatic system that is present in throughout of our body. Gradually the lymphatic fluid is transporting, and here you can see it is ending in the venous system. This is the venous angle. Everybody can see this venous angle that is made up of internal jugular and the subclavian vein. So this is the end point, the fluid from all over the body collecting, transporting in the all over the body and end in the venous system. So what is the function of the lymphatic system? Why the lymphatic system exists? Everything we know, the circulatory system is there. They can circulate all the content. What is the need of the lymphatic system? But yes, the lymphatic system, it is an accessory route. You can see here in this figure, it is an accessory route. Extra route is required. Why? Because artery, vein, this circulation, they transport all the cells and oxygen, carbon dioxide, lymphocytes, everything. But some cells and protein, some contents which is having the larger molecules, they are very large, so they cannot enter directly into the venous system. So that's why this accessory route is required. They travel all these extra content which cannot travel directly into the venous system, and they can travel with this lymphatic system. So the lymphatic fluid contain what we call as a lymphatic load. The lymphatic load in this lymphatic system, they contain water, protein, long chain fatty tissues, and some cells. So these all are the larger molecule content which cannot directly go from artery to vein. So they all are traveling from the interstitial space, interstitial tissues into the venous system, into the bloodstream via the lymphatic system. So the purpose of the lymphatic system to drain all the substance which cannot go directly into the bloodstream. So they collect and transport the lymphatic fluid from the interstitial tissues to the bloodstream. Okay. So function of the lymphatic system is regulation, of course, immune surveillance, and the transport of the large molecule. Here the lymphatic system anatomy. Here you can see the lymphatic capillaries. They are lymphatic capillaries. They are